Cups, so I'm getting close. Thank you so much. We had a lot of competition this morning. I counted up. I think there are like 37 workshops going on right now. And we're all the way at the end of the ground level here, so we appreciate you finding us and making time for this really timely and important subject matter. We've got an amazing panel here, and you're going to hear from all of them in a second. But I just have to say, we are very fortunate that Labor Notes hosts its conference in Chicago, and you'll find out in a little bit why. After I speak, I'm going to introduce my colleague, Sarah Kunstler, who's based here in Chicago, and then you're going to hear from our panel. But we are going to allow a lot of time at the end of the program for Q&A. We want to hear from you. And I'm just curious before we get started, do we have any veterans in the audience today? Wow, awesome. Thank you all. Fantastic. Do we have anybody here that has an immediate family member or a relative, friends that have used the Veterans Administration? Fantastic. That's really great. And do we have anybody here who's interested in learning more about how we're going to protect the VA from privatization? Yeah. Okay, just making sure. All right. You're in the right place. We've now had about 15 months of the Trump administration and this current Congress. And we already knew, based on the platform when they were running, what their view of federal employees and the VA was going to be. But some of you may remember that even on week one, the very first issue that they tackled was an executive order that placed a hiring freeze on the federal government. When they originally said that, that included the VA, the Department of Defense, the Social Security Administration, the EPA. And the VA, at the time, had close to 50,000 vacancies, right? If you fast forward a couple weeks, so February comes around, and President Trump decides that he's going to roll back an executive order from the previous administration and open up federal prisons, which AFGE represents, federal correctional institutions, to privatization again. Who gets the first contract? The GO group, who gave all the money to his campaign, right? So we get the trend where they're going. March comes around, President Trump puts forward his skinny budget. What does he put forward in that skinny budget, his outline? 30% cut to the Environmental Protection Agency, 30% cut to the Department of Labor, on and on. Then the summer comes, and we have an expert here who's joining us from Washington, our kind of chief VA lobbyist and expert in all things VA, Marilyn Park, who's going to tell you a little bit more about the Accountability Act, which was the only big legislative accomplishment last year, which basically took the rights of frontline VA employees, a third of them veterans themselves, tore it up and threw it away. Those are due process rights for frontline VA employees who are the whistleblowers who help expose the things that need to be exposed in the VA. So, long story short, federal employees and VA employees especially are under attack. You're going to hear more throughout this morning about how we're fighting back. But what's been really clear from the Trump administration, now from outgoing Secretary Shulkin, you may have seen the op-ed in the New York Times, what's been really clear is that the way that you break up and privatize federal agencies, public sector jobs, state, local, same thing, is to go after the union, right? We see that time and time again. So that the Koch brothers and Trump and the people that he's got can break apart the unions, boy, there's a cash cow waiting for them at the end of the day. With the VA, with the Environmental Protection Agency, with Social Security, you name it. So we're really excited that you're here because frankly, it's going to take a major coalition to stop this from happening. And I'll just alert you, you're going to hear about it, but there's a group from the Koch brothers, funded by the Koch brothers, called the Concerned Vets for America. And there's a lot of money being put into this campaign. So we're so happy to be here at Labor Notes with all of you. And with that, I'm going to pass it over to my union sister here in Chicago, Sarah Kunstler. Thank you all.
Thanks, Ian. Good morning, everyone. I'm Sarah. I'm with AFGE. I live here in Chicago. We're, again, thank you for making time this morning, and in competition with all the other really fascinating issues and important work that's being done this weekend, to come here and learn about this issue around the VA. It's something that we don't hear a lot about. In fact, when you do hear anything about the VA, you hear about how it's crumbling, how there's scandal after scandal, they're doing this wrong, they're doing that wrong, and we aren't hearing a lot of the good things about the VA. And we're not hearing how important the VA is to veterans in our country. And so we're going to hear some of that today as well. But in Chicago, we have sort of a unique thing happening, and it's unique because it's not happening in any other parts of the country. AFGE has been really invested in this fight to protect the VA from privatization and protect our employees. But we haven't done a good job of building coalitions with veterans organizations and other unions to help us in this fight. Here in Chicago, a great group of people have come together. We have unions working with patients at the VA. We have veterans organizations working with unions and patients at the VA. And we are building something really special, and it's new. And we haven't done a tremendous amount of work yet, but it's building, and there's a lot of enthusiasm building around it. So we're going to talk a lot about that coalition and how we've been able to build it and kind of our plans moving forward, as well as maybe some ways that you guys can help take the fight back to wherever you are from. How many folks live here in Chicago or in Illinois? Okay, so we have a fair amount too that are sort of outside the state, which is great because we are going to need help building this group out from here in Chicago. So I'm very proud to introduce a fantastic panel that we have here. We have folks representing the labor unions that work or represent people at the Jesse Brown VA here in Chicago. We have veterans who use the VA. And we have everything in between. So I'm going to let our panelists introduce themselves and talk about why they're here today and who they represent. So we'll start with Marilyn.
Hi, I'm Marilyn Park, and I am in the legislation department at AFG headquarters, and I lobby exclusively on VA issues. And we
You might want to use the microphone.
I'm so sorry. I'm sorry. Is it on? Can you guys hear?
This one's on.
Here, this is good. Thank you. Right. Hi, good morning, Marilyn Park. I am in Washington, inside the Beltway at the American Federation of Government Employees, and I lobby exclusively on issues pertaining to Department of Veterans Affairs, the healthcare, the folks working in benefits, cemeteries, and just all the workforce issues, but of course the bigger issues of the future of the whole VA healthcare system, and frankly the whole agency is under attack. And I'm very happy to be here today because we're getting hit on two fronts, decimating our rights as federal employees and decimating the entire system as the best example of single-payer healthcare we have in this country. So looking forward to learning from all of you.
Hi, my name is Adelina Marshall. I am a registered nurse. I'm also the director of the RNs who work at Jesse Brown VA under NNU. I am a proud member of National Nurses Organizing Committee, National Nurses United, the largest RN union in the country, and we represent over 150,000 RNs, 11,000 RNs at the 23 VAs. We are also a proud coalition member of the Right to Heal campaign. Working for the VA and caring for our veterans for over 21 years, I'm here to tell you that the veterans need the VA and want to receive their care at the VA. Funding for the VA should be just that, to support our veterans and the VA system, not those who are on Wall Street.
Hello, Mark Dykes. I'm a 12-year Navy veteran, Hospital Corps. Work at the Jesse Brown VA, medical technician, and union steward for SEIU. And I think we all know why we're here, and got a lot to talk about.
Good morning. My name is Ann Lindgren, and I am one of the founding members and current president of AFGE Local 789 at Jesse Brown VA, and I'm also a veteran of the United States Air Force. We represent over 600 professional employees, about a third of which are also veterans at Jesse Brown. I've been a federal employee for 16 years and have worked at Jesse Brown since 2010. Starting a new local was not part of my plan as a federal employee, but was born out of necessity when, after reporting concerns of inadequate treatment and patient abuse within the program I was working in, I was retaliated against. Our local was certified by the Federal Labor Relations Authority in June of 2012 and has gained steady momentum over the last 6 years. Starting and leading a new local has been one of the most challenging things I've done. Many of you may not know, in the federal sector we are open shops, and must represent everyone within our bargaining unit regardless of membership status, which can be a real challenge. Additionally, the political climate has been tough. The Obama administration was not an advocate for federal employees, and now, if the Trump administration has their way, federal unions will be destroyed. As a veteran, the continued privatization of the VA is an issue that means a lot to me, as I know many a story of how the erroneously named Choice program has failed many of my fellow veterans. After organizing a press conference this last fall for the purpose of educating the public about the over 49,000 vacancies throughout VA, I was introduced to and began working with the individuals on this panel today. Together we formed the Right to Heal campaign. I'm excited to have the opportunity to speak here today about our efforts. Thank you for having me.
Hi, my name is Roberto Clack. I am neither a veteran or a union member. I'm an organizer. I've worked with Aaron Hughes and Barry Romo, Iraq and Vietnam veterans against the war for years. And being an organizer, they've allowed me to kind of do my thing and help get this table together of different unions, different veterans groups. And, you know, I didn't come into working with veterans because of healthcare issues. I became involved because of the war, organizing against the war because we thought it was wrong. But while doing that, I realized this population had intense healthcare needs and that the VA saved lives, although it could be better many times. But it was the best healthcare system out there. And taking away the VA, hurts veterans. The idea of the suicide epidemic's not abstract to us. So privatization will destroy lives, and that's why I'm here. That's why I do this work, and I couldn't be prouder to do it with this amazing table and group of people here today. Thank you.
My name is Barry Romo. I'm a disabled Vietnam vet. I joined Vietnam Vets Against the War 46 years ago. I was pro-war when I went over, and I came back against the war. And I still oppose adventurous wars. I come from 4 generations of veterans. My father was a disabled World War II vet. My nephew died in Vietnam, and in fact, I brought his body back early. My father was a trade union person. I went on strike as a meat cutter for over 2 years during the Depression. And he told me when I got back from Vietnam and started to go to work, there's 3 things you have to remember as a working man. Always join the union, never cross a picket line, always vote Democratic. I went to work for the post office, and I worked there for 32 years, and 31 years of those, I was a steward, a chief steward, and president of my branch.
So we have a series of questions for our panelists that I'm going to be asking to kind of tease out sort of what the issue is, what's been happening, and then we will open it up after that to allow questions and some discussion among the audience. One thing I wanted to mention, Suzanne Gordon is sort of an expert in the VA and healthcare in general. She has written a book. She's written several books, but her latest is The Battle for Veterans Healthcare. It talks all about what's happening. And so at the end of the session today, we're going to give everybody here a book. So don't leave without it, unless you leave early and then you don't get one. But I want to mention that because we want you guys to take this fight with you and and learn more about it, because this issue is really dense.
This is a great program, but could we keep using the microphone?
Oh, are you having trouble hearing me?
Oh, well, some of us are.
Oh, you got it. No problem.
Turn
We got
the other
2
one
mics.
on, because that one, okay.
Sorry about that.
Thank you.
All right. So we are going to start with Barry, since we ended with Barry. So as somebody who uses the VA system as a veteran, can you talk about what the VA means to you, and your fears around what's happening?
I use the Veterans Administration despite the fact I have all that good insurance from working for 32 years for the post office. I find it to be better than private things at all, and I don't come out busted. I had an operation to clean my throat, and I ended up having to pay $3,000 because the anesthesiologist hadn't contacted the union beforehand. One of the things that helps by taking our problems as veterans to the Veterans Administration is the fact that they're able to collate problems. With private industry, if you were looking for PTSD or Agent Orange, radiation poisoning, or burn pit problems, they wouldn't even care. If they did and wrote it down in your record, it still wouldn't be shared with another place. I didn't always go as an anti-war, anti-authoritarian vet. At first, I couldn't walk to the VA. It was a government agency. The government had lied to me to get me to go to Vietnam. And so it took a while. But I'm there now, proudly there now, and really appreciate the people there.
Great, thank you. Does anyone have anything to add, Adelina, Mark, Anne, or Roberto, of course, about kind of what your thoughts are as veterans and employees?
Sure, I would just like to add, and I know Marilyn's probably going to get into this a little bit later, but the thing to remember regarding the privatization of the VA is we are taking a healthcare system that's based on treatment outcomes. That's how we're measured currently. And privatization, which is not something that's going to happen in the future, it is happening now. There's about a third of our care that is being privatized through the Choice Act. Privatization then takes this care and it's measured through profit. So that's a very important thing to remember during this entire conversation today.
Hello, Mark Dykes. Yeah, I work for the VA also, and I think I have a more unique perspective because before I worked for the VA, when I got off active duty, I went to work for Aetna Insurance. So I was working for the people that jack up the prices, and we had I was working an account that basically I was doing discharges and admissions. So we had an account that was called a gold card, and we had to keep that secret. So I'm not there anymore, so I guess it's not a secret anymore. But so basically it was get you in and out. And the more money that we save because you're out of the hospital, we don't have to pay. And so we had a gold card, and if you met that gold card standard, we paid your bill right away, no questions asked. So if we got you discharged within 3 days, no questions asked, we paid a bill, the hospital's happy, the insurance company's happy, you're out of there. So if you stayed more than 3 days, then we request a clinical review. How much did you pay for these labs? How much did you pay for this intervention here? Oxygen, blah, blah, blah. And so it was cost driven. It was about making profits, satisfying the stockholders. When I worked for Aetna Insurance, I bought company stock. I was working full time and I was taking classes at Truman College, one of the city colleges on the north side. And I was taking an accounting class. I don't know nothing about accounting. I'm not a CPA, I'm not an economist. I pay somebody to do my taxes. I got a tax preparer, I admit it. And so I bought my stocks, and when they bought in, I bought it in at $18. This was back in 2008. And the Affordable Care Act with Obamacare was kicking in, and everybody was arguing and fussing. And one of the things I noticed about it was that they took away the government option. So if you look at the VA as a model, and you look at Obamacare, And what a good thing it would have been if we'd have had a government option. If everyone, regardless of ability to pay, is able to sign up. If I, unemployed or I'm only making X amount of money, okay, the government is going to supplement you and help you. If I go to the VA, regardless of ability to pay, what was that FDR said? I promise to take care of all veterans for the rest of their life. I believe FDR said that. So why not take care of all Americans? Why not take care of all of us? Not to drag this out, but
You're taking care of part.
Let me just finish my point about the stocks. I bought my stocks at $18, and those stocks at Aetna is 170.38 right now. And my accounting teacher said, hold on to your stocks, don't sell them. So I do listen. Thank you.
Thank you. While I am not a vet, I have family members who are veterans, and I have a brother who committed suicide a few months after being discharged from the military. He left 2 sons, both of them are vets. One was not born at that time, but both of them still suffer from those actions that was taken when he made that decision. At that time, the VA was not a place that he felt he could go to receive care, and the family struggled with trying to find support for the depression that he was suffering. There is already a major mental health crisis in the United States, and with limited capabilities and capacity to provide care for those who do have mental health concerns. We have hospitals that are closing every day. Many of them are closing because they're being gobbled up by other larger healthcare hospitals that are being run by those on Wall Street. We feel by dismantling the VA would also lead to dismantling of, it would be a first step to dismantle Social Security, Medicare, and Medicaid. So as we're advocating for health care for all, it is really slipping away day by day, actually as we speak. Systems now are also overloaded as the VA. They are short-staffed, as we are too. A lot of the money that the VA is sending outside can be better used to hire more staff to provide the health care that is needed for our veterans. I just sent a letter Thursday. I'm off Friday, Saturday, and Sunday because of concerns that we have on our mental health unit for understaffing, and asking that they give us staffing plans to make sure there's adequate staff on that unit. We've had reports of 3 RNs having to care for over 30 acute mentally ill patients that we serve. So the VA is already impacting the VA, trying to understaff, underhire, to have the veterans complain about the service there. But in units that are adequately staffed and have, and this is frontline staff, not just RNs, but also support staff, the patients enjoy the care that they get at the VA. But as any other situation, when you're trying to, make purchases or get health care, if your appointments are running late, you're upset, and we do have people who will leave. But if we had adequate staffing and adequate funding for staffing and a program to retain the staff that we have, so even though we're hiring, we're losing them because of the staffing issues. We need staffing ratios. We need laws that will mandate the amount of staff that we need. So saying that, I'll pass this on and I'll answer other questions as they come up.
Keep talking a little before we take questions. Some questions.
No, we're going to hold questions until the
Okay,
end. Yes.
I just want to stick with the theme now, and that we will, my panel's co-panelists have been discussing, which is why the VA is so much better care for veterans than the private sector. And I think there's been so much fake news lately by the privatizers, and those who are going to get rich are already getting very rich off the VA through the private programs we already have, about, you know, the private sector is the best care ever and the VA is the worst. It's literally the opposite of the truth. Every study shows, number one, and we're talking RAND, we're talking all sorts of Institute of Medicine type studies, very reliable. VA outperforms the private sector in primary care, in mental health. They are the lifesaver. They are the people who have developed all sorts of best practices and medical treatments that have benefited. So it's the opposite. Not only is the private sector so much less adequate for veterans, but we know that it's a broken healthcare system out there, and like was said here, everybody deserves what the VA offers to veterans when it's properly funded and properly staffed. So now, of course, that doesn't even get into how much more it costs, because we now have a whole bunch of CEOs getting very rich off the VA instead of having staff doctors providing most of the care and staff nurses and all that. So obviously the VA is so much more cost efficient. They're the only ones that negotiate drug prices and things like that, which we weren't even allowed to do in Medicare. So frankly, the entire U.S. healthcare system, the good in it, so much of it is owed to the VA. It was mentioned. Virtually everybody gets trained in the VA, right? Every doctor, every nurse, it's where you get your training. All the research, you don't get research when you voucher out care. You only get research when you conglomerate, when people are consolidated together and you have the incentive to keep them healthy from the beginning to the end of their life. So the private sector would even be worse if the VA was broken up, and these massive privatization efforts are going to break up the VA so it can no longer reap these benefits. So there's just so many fake news about the private sector, but here's the thing. The private care programs they have now, called Choice, and they used to be called Project Hero and other insulting names, the truth is that nobody watches them. So every day, the news and now the administration are hammering, the VA failed this way, the VA failed in this city, the VA failed in this kind of care, and nobody's talking about how long it takes to get the care when we send you out with a choice card, how bad the care is when you get there. They're not being measured, and they don't want to measure it. So the playing field is incredibly unequal, and the VA's benefits are simply not being told the story. This book is fantastic, by the way. If you read both the beginning from Ken Kaiser, who helped reform the VA during the Clinton years, and then you read this incredible author's story, it really lays out that. And one last thing about the preferred, all the veterans groups have done surveys that show the same thing. Veterans want the VA. They want to see their doctor or nurse. They just want to see them and have them staffed so that they can get in the door. But once they're in the door, they are overwhelmingly prefer the VA. So I'll stop there.
Thank you. So just Ian mentioned in his remarks about the VA Accountability Act, which is a major piece of bipartisan legislation that passed last April, and implemented last summer. So for this was a bill that took away due process rights, some due process rights for VA employees specifically. So for the folks on the panel who work at the VA, can you talk about how this has impacted the workforce? What are you seeing at the VA since the implementation? And kind of what are your thoughts about the overarching theme of the VA Accountability Act?
So right now, currently, the Accountability Act overrides some of the contract articles that we have by cutting down the amount of time that we have to defend our members. It went into play to address management and the ineptitude of management. We have lots of that. Just the other day about the staffing shortages on our mental health unit, I had to send out everything to all our top managers to get their attention to why the manager is not available and to answer and to be accountable for the staffing that is there. The Accountability Act on the situation that we did have, we had one nurse. There was facts in her file. And we had a hard time getting the information. They stalled providing us information under Freedom of Information Act. And she was accused of giving a veteran a medication that was not ordered. However, that was not the truth. The veteran itself stated that that did not occur, but yet they went ahead and proceeded to discharge her. This nurse was very vocal about the staffing in the mental health unit, and we do believe that these actions taken was retaliatory due to her complaints about veteran care and the delivery of care on that unit. The Accountability Act is being used from the bottom up instead of as it was formed to go from the top down. And we feel that that's a way to distract from inapt management. They don't want us to question them. They don't want us to hold them accountable. On the grievances that I have filed on staffing shortages, again in the mental health, dialysis units, emergency department even, I start finding that the answer to the grievances appeared to be cut and paste from one answer, from one grievance to the next. So it showed us that they had no intention of addressing these issues. They do have long plans to address staffing. However, we need staffing now. We have patients being denied access to care, because if we cannot have appropriate staffing, we can only do the minimal care for those patients. So they're missing groups, their medication is late, and there are other things that happen on that unit to provide safety for our patients, for our veterans. We have elderly patients, we have female patients that needs the staff to protect them. And when we have very limited staff, then we are exposing the most vulnerable of our mental health patients to harm. So this Accountability Act is not being enforced from the top down, only attacking those on the lower levels. This one nurse had been off of work, came back 3 weeks post-surgery for lung cancer, and now she's out with no insurance coverage or anything.
We'll talk about another erroneously named piece of legislation. So I believe the entire title is the VA Accountability and Whistleblower Act. And so there's two pieces to it that I just want to touch on briefly. Sarah had mentioned the biggest part of it, which is it guts our contract as far as how we can protect union members from disciplinary action. In fact, I just finished with an arbitration about a month ago, and the incident happened prior to the passage of this law. And while I was sitting with HR, we were doing a pre-arbitration meeting. The HR person told me if this had happened after June of the year it was passed, they would have just tried to terminate the employee. So that's kind of what we're seeing. We're actually seeing more employees just resign if they are if they're facing disciplinary action. I believe there was I don't know what newspaper it was in recently, but there was an article on that recently about how the VA is seeing more and more folks just leave. I think that's happening throughout the federal government at this point, but with the VA in particular because of this law. The biggest problem, as far as I see from a union perspective regarding this legislation, is it changes the amount of evidence that the agency needs to have in order to discipline people. So it changes it from a preponderance of evidence to substantial. So anybody who has done grievances here, I'm sure, understands what that means. It basically is the agency says, well, we saw you, or we think that you did this. We have, an idea or a little bit of supporting evidence that you did, and that's that. They don't really have to prove that this person did what they're saying that they did. So that's very problematic. The other problem with this piece of legislation is the whistleblower part of it. If anybody comes to me and asks about how to go through the whistleblowing process, I tell them up front, do not go through the whistleblower office that was placed in this legislation. And the reason for that is because my understanding of it is this office is run by a political appointee. So I'm sure you can all see why that's problematic. So what I do is I tell folks, go through the Office of Inspector General. They are an outside entity, and they are not political appointees. I think that's all I have to say about that.
I just want to ask legislative people, right, this was bipartisan supported too, right? Like, did Senator Duckworth
There was a lot of Democrats on
support
it.
it?
On the, yeah.
So-
Senator Duckworth co-sponsored it.
Yeah, so
Yeah.
this is, you know, I think we need to look at the, I think we need to look at the political context we're dealing with. There's bipartisan support for punishing federal public sector unions.
Right.
And for privatizing the VA.
Right.
So I think we need to address these problems, but we need help from our left flank in Congress. You know, we'll get into this a little bit later, but Bernie Sanders even voted the Senate bill to privatize out of committee. You know, so we have a lot of work to do, but we'll get into all that in a little
You
bit.
make a great point.
I don't really, you know, I just try to put it where the goats can get it. The Accountability Act was intended to get rid of the upper level management that was abusive in what they were doing, stealing money, not providing proper leadership when there's a broken system. Over at Jesse Brown, we're attached to Hines. I do know that I have actually talked to some doctors that went whistleblower. There were some patients that were being medicated. The doctors weren't checking their notes, and they would go and see a different doctor on a different day, and the doctor didn't check the notes, and the patient wound up getting double medicated or triple medicated. Some of these patients died. This went to the medical director got relieved. I believe that's what the VA Accountability Act is about, to go after the upper level management that's not managing and not leading. However, lower level staff is getting affected by this also, and they're canning us. And that was not the intention of the VA Accountability Act.
I just speak about the data.
I would just like to echo about the data. Okay, so the VA, as part of the law, has published data on its website on who's getting fired. But first of all, they're not fully disclosing the problem, and secondly, we have a Freedom of Information Act request that they will not answer, saying how many of these are veterans. And we know overwhelmingly there are service-connected disabled veterans getting fired because, as my colleague said, instead of managers, they started out by calling this a Management Accountability Act, even though they were going after the VA housekeeper and claims processor. So I want to tell you, even with the published data, which is not the full story, here are the top 5 positions that are getting fired the most under the law so far. Housekeeping aide, nursing assistant, food service worker, registered nurse, and medical support assistant, which is a lot of it's the scheduling, the people that deal directly with the patients to get them in the clinics and all that. Okay, and then when you look at this bar chart, and I'm happy to email this to anybody, this was prepared by a colleague of ours, Pancho, in DC, at Rivera. When you look at the bar chart, the highest one by far, at the like 160, number of removals, was housekeeping, down, and who do you think is the lowest number? Supervisor. Okay, so we know that with all the, like you said, it was a great name for the bill, but this was really an attempt for Koch brothers, etc., to get us all to be at-will employees with no protections in the workplace, so we can't speak up, and we're terrified to fight for decent pay, working conditions, etc. And this has moved the VA closer. So when veterans come to the VA for care, they're coming to an agency where it's the least desirable agency in the government to work. I mean, these people are working there and they're very dedicated, but that is not a way to build a strong workforce and to keep people by making it that much easier to punish them. And as was mentioned about the lower evidentiary standard, so preponderance means you have to have at least 50% of the evidence in favor of your case if the manager wants to fire you. substantial evidence by the Supreme Court is the scintilla of the evidence, that you can have a very small amount of evidence in favor of management and overwhelming evidence in favor of the employee and still get fired. So what's happening is it's empowering them to fire people on the first offense with no opportunity to improve. And that's where you have people resigning too. And last but not least, if I can mention in the law, there's a provision where you can lose some or all of your federal pension if you've been convicted of a felony. So in some states, that could be a DUI. And it only has to have some link to your job, and you can be sure that a manager will always find a link between something like a DUI or some other smaller thing defined as a felony in that state, and they'll say it relates to your job. So while we think that might be unconstitutional, it is just another way, as we've seen in the news, to intimidate employees, go after their pension, go after their job.
I just, before we move into the next segment of questions, in 2014, when the Phoenix scandal was happening, that kind of sparked the outrage and the media frenzy around the VA. It was rank and file employees. In fact, it was AFGE members who blew the whistle on what was happening in Phoenix. And the VA accountability is the biggest slap in the face to whistleblowers who are trying to protect veterans that they serve and the agency that they work for. And we did try very hard to convince our friends in Congress that this is what was going to happen. And they didn't believe us. And there were any number of folks from both sides of the aisle. And this was not the first attempt to pass this bill. They've been trying to pass this legislation for years. And they exploited this issue because it's attached to veterans, and nobody wants to appear anti-veteran, and to vote against this bill would be to vote against veterans. And they're also, just one other point, they're also using this as a model for other agencies. So there's already a bill going after Department of Labor employees to basically implement the VA Accountability Act to DOL, and also to, there's been a lot of discussion already. We know that a bill is coming if it hasn't already been introduced government-wide.
Yeah, there's several sessions now. We've got government-wide, Indian Health Service, labor, education. It's spreading very
Yes.
quickly.
So, and so because we have this situation at the VA where they're able to exploit it, they're using the VA as a place to sort of test out legislation before it goes out into the rest of the government. So in the interest of time, we're going to move into just the organizing discussion, and then we will answer all of your questions within a certain time limit. This coalition came together in Chicago pretty recently. So we'll start with Roberto. If you can talk about the work that the coalition has done so far, who we are, and how we came to be.
Yeah, so, this was, and I should really give a shout out to National Nurses United, especially, because really, this was Aaron and I, if you could just raise your hand, he's an Iraq vet. Originally when we did this project, it was with the Nurses Union first back in 2012, and we got all kinds of things done when labor and veterans as labor people using their voice was a powerful way to fight back. And we started with the Nurses Union. We brought AFGE in. Once we saw, what was going on with Trump, I talked to Barry and Aaron. I said, we got to do something again. This is worse than ever. They got this right-wing agenda. They're going to try to dismantle this thing unless we get involved. So we got everyone at the table, and we've been organizing. We had our first event on March 1st, 130 people there. About half of them were veterans. We got over 100 veterans contacts just from flyering at the VA. And I think I think with Secretary Shulkin's firing, I feel like we're in a very pivotal moment in this fight. And I just woke up one day, you think of you're an organizer and you dream about organizing, and it's, I woke up and I'm like, holy shit, excuse my language. I mean, what this moment reminded me of was Wisconsin in 2011.
Amen.
That's what it reminded me of. the Koch brothers, Trump, the right wing, they want to dismantle the federal government, public sector unions, these safety nets. That's what we're up against. This is what the organizing moment is. But you have to go for the heart first. That's what they did in Wisconsin, and that's what they're doing with the veterans. And someone at our town hall said it. You know, a veteran unprompted, he said, you have to take out the veterans first. You have to take out the veterans first. You know, 'cause there's a certain social capital that they have and, you know, some organization within their veterans groups. But once the VA falls, Social Security, Medicare, Medicaid is next. Single payer is also off the table. And I think that's what we need to acknowledge as a movement. This is why we need veterans organizations to come together. This is why we need unions. This is why we need single payer activists. Single payer in the fight to save the VA is the same fight.
That's right.
That's what we're looking at right now. And we've had to educate people first. That was the point of our town hall in Chicago. We not only had to educate the veterans, we had to educate the union members, we had to educate public health. You know, there's great single payer activists. Most of them don't know anything about the VA.
That's right.
We've had to educate our own local community who already does this organizing as to why we need to take on this fight, why it's so pivotal, and why it needs to grow into other sectors of organizing. And that is exactly what we've done. But look, we're going to have a powerful coalition in Chicago. We already have a powerful coalition in Chicago. It's going to get stronger, but we can't do this just Chicago.
That's right.
We need this to be city after city. We need this to be a national movement. Otherwise, we will lose. We have to stand together. We have to replicate this organizing. And that's the only way it's going to really work. And, you know, Aaron and I met with a longtime friend of ours, Carl Rosen. And, you know, he's UE, you know, all-time UE organizer, someone who supported us from the beginning. And he's like, well, you know, this Right to Heal thing sounds great. You know, you need to use this as a way to help save the labor movement by getting veterans who are disproportionately labor union members to give a shit about a public sector.
That's right.
And you need to get veterans who are trade union members to care about saving the VA and to move their unions into a better political space. And, you know, that's also something we have in mind. We have steelworkers who've talked to us who want to help the Right to Heal campaign. SEIU Local 1 represents security guards, private sector. Guess what? There's a bunch of veterans who are security guards. You know, we need to bring them into this coalition as well. You know, so I think there's a tremendous opportunity, especially going into 2018 and 2020, to use this issue to beat back the right wing, to say Trump uses veterans to promote a right-wing platform. We're going to use it to promote a platform for single payer. The VA is socialized medicine. That's not a dirty word. It works. It's cheaper. It's more efficient. It saves lives. We're going to keep organizing. We have a veterans meeting April 14th. We're going to consolidate the veterans, our base of veterans. It's growing. We're going to meet again at the VA because we need more of the, you know, Ann and Adelina. They feel like, you know, some of their comrades aren't there enough. We're going to go back to the VA. We're going to organize a town hall to get more union members involved. And after that, we're going to get petitions going. We're going to get thousands of them, and we're going to march from the VA to the senator's office, downtown Chicago, Senator Dick Durbin, Senator Duckworth, and we're going to say, hey, you have to, you're not going to vacillate on this issue. You are going to save the VA. That's exactly what you're going to do, and if you don't do it, you're going to have a huge political problem in the next elections. We are going to hold you accountable. This is just the start of the movement, but we can't just do it in Chicago. So we hope that this inspires you to go back home and do some organizing, because the VA needs to be saved. And thank you.
For office this year. Appreciate that. Anyone from the panel want to add to that? If you want to follow it.
Well, I think the one thing is missing is that the VA belongs to the veterans. It does not belong to the private sector. And non-veteran administration, Congress, Senate, President, are making decisions for the veterans, and they're not even veterans. The veterans need to make their own decisions, and the VA belongs to the veterans, and that's the motto that we need to have. That's what I tell our veterans. This VA belongs to you. I don't work really for the VA, I work for the veterans. I advocate for your care, and at great threat to myself for unemployment and to my family, but you know what, I'm down for it. The veterans have been there for us. We have this freedom to meet today and speak as we do because of our veterans. The VA belongs to our veterans.
Healthcare is a right, not a privilege. And everybody should be included, and not because of how much money you have in your pocket. You shouldn't be discharged because you don't have insurance. You shouldn't be stabilized and discharged because you don't have insurance. I think it's a crime, personally, and we need to do something about this. Show up at the polls, register to vote, contact your senators, your congressmen, and just make some noise about all this. And this is just something that we all have to do. We're all in this together. And the government option back in 2008 got gutted. And if you look at the VA as a model, this is something that could be used for everybody. And private interests, kicked in and deceived the people, and now we just have to reorganize and make this happen and make it stick.
I just want to say something really quickly. As was brought up earlier today, the problems are bipartisan. The answer is not just to simply vote Democratic anymore. Those days are over. I believe during our March 1st panel discussion, we had some elected official staffers come through, and I think they reached out to Sarah afterwards and said, hey, we didn't know all of this stuff that you're presenting. And I know how overwhelmed I feel every day reading the news about this drama and that crazy stuff going on. I can't imagine being an elected official at this point, trying to keep up with everything. So it's really unfortunately come down to, it is our job to educate these folks and to hold them accountable, and also to find folks who are willing to run against, let's say, Senator Duckworth, if she wants to continue supporting these sorts of things. And I know that's a hard.
You'll probably need to be a veteran.
Yeah, and I need to be a veteran. But I think organizing is one part of, it's a large part of what we need to do, but we also need to think bigger picture. So if anybody from either who's here in Chicago or in different parts of the country is interested in getting involved, we'd love to see you at the table afterwards. I know there was a group of veterans, Veterans for Peace. They just held a picket near the Bedford VA hospital. This is the sort of thing we need to start doing. We need to have these picketing and organization, people coming together around the country. If it's just here in Chicago, as Roberto said, this isn't going to work. So that's all I had to say.
All right, so I'm going to hand it over to my colleague Ian for just one quick piece before we open up the floor for questions.
Thanks so much, Sarah, and thank you, everybody. I want to make sure we have enough time because I'm sure you've got questions, and the questions will be to all of you. So we're going to keep the conversation going. But I'm going to pass it over to Marilyn really briefly, just for a legislative recap and just kind of to let you know what we're facing currently in Washington right now.
Okay,
Marilyn.
sure.
So the big scary thing now is the bill to replace the temporary choice program with a permanent program. And what they want to do, and what the Democrats need to stand up against, is a permanent expanded private care program. This private care program choice, which is really not taking away choice, has already been a nightmare. I think everyone here who sees it on the ground sees that people are being sent out there for fragmented, inferior care with no accountability for whether it's on time, and they are basically being sent out of the VA because there is not enough staffing in the VA. So the solution, of course, is never to give the money back to the VA, but to put even more money into choice every time it runs out of money, and VA gets a crumb while they get billions, and now to create a permanent program. But the White House wasn't happy with the Democratic plan that got kicked out of the Senate committee. Somebody here mentioned. So I think it was the, I don't know if it was earlier this year, but anyway, the bill that you want to worry about is S2193. S2193 is the bill that is moving to make a permanent expanded private care program. Now, what they just did, we just kept the government from, there was a success of keeping the government from getting shut down by getting an omnibus funding bill. So, the government didn't get shut down again about 2 weeks ago because they got funding through the end of this fiscal year. But what almost got in was this bill I'm about to tell you about, S2193, that would vastly expand this dysfunctional, extremely expensive private care program for veterans, coupled with, unfortunately, a really good program for people who are caregivers of veterans, because they were trying to, get the VS Veterans Group support by offering that. And then the third piece of it was something you're going to hear about on this handout. Everyone knows what a BRAC is here. When you use the BRAC to close military bases, you instead of members of Congress deciding what to close, they created a private commission. It did not work well because it did not save money. It was very expensive, and it wasn't an efficient way to close military bases. So they've decided to BRAC the VA and shutter the doors of VA through a private commission and take that power away from members of Congress. So that's not law yet, but we're going to be asking you to mobilize around that. But equally important, I just want you to know what AFG is doing now. We have sent letters to everyone on the Hill to say this bill, S2193, which came from Secretary Shulkin. Everybody here has heard about Secretary Shulkin getting fired for not privatizing the VA fast enough. I mean, he's no angel, but he didn't want to privatize the VA as fast as the Koch brothers wanted him to, so he's out. And you can be sure whoever runs the VA next is going to do exactly what the Koch brothers want. So we've taken a bill that was already going to open the floodgates. It was going to allow huge chunks of the VA to be closed overnight service lines. So certain entire clinics would be gone from facilities. It would let contractors once again run the networks of doctors. It would allow people to leave the VA and get care outside the VA for literally unlimited criteria. And there would be no attempt when the VA can provide the care short term to make sure that it gets the capacity back. So it was already a horrible bill in the hands of a holdover from the Obama administration, David Shulkin, who, again, let's not put him on a pedestal, but he still wasn't privatizing like the Koch brothers. So now we want to give that bill, put it into law, and have the Koch brothers VA deciding how much to privatize. So that is our push right now. Do not allow S2193 to move. Of course, don't like any BRAC bill to move, but they'll probably move together, and I think that's what these calls are about. One last piece about S2193, my colleagues here talked a lot about mental health in the VA and how unique it is. Another thing that bill would do is allow mental health care to be provided through walk-in clinics. So you would have this Cohen PTSD network, which is out to get very rich off mental health care in the VA. And imagine walking into a shopping center clinic to get your PTSD care. I mean, it is fragmented, it is absolutely the wrong place. We can't think of any care that has to be in the VA, but also you can't take mental health care out of the VA. You can't take primary care out of the VA and have it done at an urgent care clinic. That is crappy care. That is not the kind of care veterans with complex needs need. But that's what S2193 will do, and they're going to try to bundle it again with with this BRAC bill, which has a House number. So I'm going to stop there and let you talk about the mobilization around it. HR 4243 is the bill that they're going to ask you to make calls about.
Yeah, and we I just want to add something. It's important that we fight these bills. This is critical. We have 3 unions here, and we have a very principled union that always puts the most forward-thinking kind of legislation out there. There's a bunch of labor people here too. We need a counteroffensive.
Right.
There's some veterans here. You know about that. We need a counteroffensive to this. All right, I won't curse. We need a counteroffensive. We need our own bills that don't vacillate on privatization, that are principled. We need some sort, keep the VA public, funded well, and we need to put out that kind of bill, and it needs to come from our movement, and we keep that line the way the nurses did with safe staffing ratios in California, the way we fought for 15, the way the Chicago Teachers Union didn't vacillate on charter schools. This is what we also need to create as counter legislation as a movement. So I just want to put that out there because we do have to fight these things back, but we don't want to be on the defensive all the time. We have to go on the offensive, and we have to create a vision for what we want to accomplish as a movement. So I just want to, we don't have anything drafted, any legislation, but I think it's at some point we will, and we're going to need public officials who advocate for those things and don't compromise on something that works. Thank you.
So we're going to go to the Q&A. I just wanted to let you all know, you saw a script on your seat, and we're going to talk about that in a second. Marilyn mentioned that about these 2 bills. We also have a little postcard here. I would ask you to fill it out. I'll make sure these pens get out. We have some AFGE pens in case you don't have one. Please feel free to keep it. But we would ask you to fill that out and either leave it on your seat and we'll collect it, or bring it up afterwards if you want to be a part of this fight. And with that, we will turn to a Q&A. We've got a lot of questions. I'm going to, Sarah, would you want to help pass the mic around?
Your mic?
Or you want?
Well, come with me. Maybe you can just repeat.
Here, I'll do the
Here's what we do. We're going to do this a different way. You're going to say it, and I'm going to repeat the question for our panel. That doesn't work? I've been overruled. Okay, here we go. Thank you, Jason.
Yeah, good morning, brothers and sisters. My name's Howard Ehrman. I'm a longtime labor organizer, and I'm a physician who got trained and worked at the VA, which was called the West Side VA, Jesse Brown, from 74 to 81. I really want to thank all of you for doing this campaign, and I'm ready to do whatever is necessary. I'm retired now, but I'd like to make a couple points. Number one, all of you have said really important stuff, but what has to happen in this campaign, as I think the brother just said, it's got to be turned into a positive campaign. We've got to have testimonies from the workers inside the VA and the veterans who use it about what's good about the VA. We got to stop being on the defensive. I mean, we can say things got to be better in the VA, we should name what those are, but we have to have videos, we have to have testimonies face to face, block to block, church to church, where veterans are talking about why I go to the VA, period. Number two is we have to deal with the leadership of all the other public clinic unions. I was one of the original state and city organizers for AFSCME, and I can tell you we have a huge problem with the leadership nationally and locally with the unions who work with public workers. I'm going to name them: AFSCME, SEIU, AFT, NEA. Why is that? It's because they believe in public-private partnership. They don't believe we can fight privatization. They work under the Cornell Labor Institute paradigm that says we cannot win against privatization. This is the most important struggle in history against privatization for all of us, and I think you've got to relate it to Medicare, Medicaid, Social Security, and the post office. We had a few postal workers here, and that's another key factor. Third, we've got to deal with, we have to deal with what's called the nonprofit industrial complex. In the CHOICE program, it was farmed out to 1,300 federally qualified health centers primarily. Only about 5% of those federally qualified health centers, which are known as FQHCs, are public. All the rest are private, and by law have to be nonprofit. That is not a solution, and we've got to put that forward. Thank you.
Thank you.
I just want to echo your point.
No healthcare system is perfect, And like you said, we should acknowledge when the VA needs not just resources, but correction. But what is more likely to get corrected? A public health care system that can be called before the Congress and other agencies that look at it, or a private healthcare system that's secret and all about defensive medicine. So we're never going to fix that. Only the VA can get fixable.
You want to take two? Yeah, let's take two. We're going to start with Vito. We're going to take 3 questions.
All right, my name is Vitol Skirachinsky. I represent Social Security employees nationwide for AFGE. And I'm sorry I walked out for a while, so I missed some of the stuff that was said. We have a big problem in AFGE in mobilizing our workers. The VA, the legislation that passed in the VA, which made it easier to fire VA workers, is horrible. AFGE launched a 2 or 3 month campaign to get not only VA members, but members of AFG nationwide to contact their legislators, and they only got 40,000 calls. The VA has 125,000 members in AFG. There's 380,000 VA workers. Now that means that not only did VA members not call, certainly their families didn't call, certainly their people they associate with didn't call. There doesn't seem to have been any calls coming from veterans groups either. So it's encouraging what's happening in Chicago, but this is not happening elsewhere in the country. And it's absolutely necessary. It shocks me that veterans would sit back and say people who service them, it's okay if it's easier to fire them. The rank and file workers are not the problem in the VA scandals, it's management. So we need to form a strong coalitions between veterans and the unions that represent VA workers. That does not exist now. And also, we need to understand in AFGE that what happens to the VA will happen to all of us. Now, the Trump and his minions are not just attacking VA privatization and trying to make it easier to fire VA workers. They're going after the government employees as a whole.
Yes.
Department, they're going after, and there's certain things they can't get passed through Congress. So they've come up with a way that really will break us, and that's going after our contracts. And they've done it with the Department of Education. They've gutted their contract. Our contract's up. They're going after us. The VA's having problems with their contract too. So not only do veterans need to support the workers who work in the VA on these kinds of issues, but also our contract issues. Now in SSA, we've gotten alliances with Social Security Works. We can get 500,000 signatures on anything just from a coalition of SSA groups that we're affiliated with. But that doesn't exist in the VA yet, and that needs to happen.
Thank you, Vitol. I'm going to come over here real quick. Hi, Dan Bailey.
We've got a response.
Oh, we were going to do 3. Okay, yeah. Go.
You have one answer?
We're going to try to keep questions short, responses short, and we'll get out on time.
Can I respond to that? I'm one of the first level employees. When you come into the VA, you're probably going to see me at the door when you walk in the door. I'm in the lab, I'm drawing your blood. The doctor will give you an order, you come and you see me. So majority of the patients, I'd say probably all of them, will probably eventually come and see me. And I have these conversations. When I was becoming a union steward, I've only been a union steward for a year. I had to get 35 signatures from different union employees. I heard a range of complaints. I do know, I think I gave you a little bit of my background. Back in 2008 when I worked for Aetna Insurance, me and 500 people got laid off. So one of the first things I thought to myself was, well, hey, I don't like getting laid off. I want to go work for the federal government. I have me some job security. So I work for the VA. You heard about the Accountability Act. You heard about all these things going on. I'm talking to these veterans that work for the VA. They're lazy. A lot of them have gotten laid back and gotten comfortable with their job for life, and they're not showing up to these events. They're not participating. we're talking to them, and we do have some union leadership that are lackadaisy and doing what they need to do to get the word out. So on my end, I'm working with these people that are not doing their job on the union point of view. And also, there are some veterans that are employees that are sitting back collecting a check and not getting involved and don't care. So there's two sides of that story, and I understand exactly what you're saying. And yes, we all have to come together on this.
Can I just say something real quick? To your point, my AFG brother over here, I have brought this up in our coalition that, for example, when I organized a press conference back in October, I had maybe a handful of bargaining unit employees show up. It was during lunch hour. It was a bright, nice sunny day. It was on the corner, right in front of the hospital. Hardly anybody showed up. The panel discussion that we held, I had 2 of our bargaining unit members show up out of that 130-something people. Now, I've only been doing this work for about 6 years. I was never part of a union prior to this. I've been in healthcare for 28 years, most of that on the outside. And what I've come to find in my experience is we need good old-fashioned organizing. That is what we need. Our members are they're not responding because we're not getting out there talking to them about it. Now, myself as a union president, I'm busy doing arbitrations. I'm busy doing grievances. I'm busy writing leadership at Jesse Brown right now because of how filthy the hospital is. I don't have time to go and speak to people about organizing. I can call the district office. They'll send me somebody maybe once a week, or once a month, twice a month. That is not enough. We need organizers in that space every day talking to folks.
That's right. So just due to time, I think what we'll do, if the panelists are willing to just take notes on the questions, we're going to bundle these last questions because I do want to hear them all, and maybe there's some overlap. So let's start over here, and we're going to get to everybody here, but we're going to bundle.
Dan Bailey, and you just, as I remember, wasn't it that the VA, if it wasn't for the VA, we wouldn't have found out about things like Agent Orange or PTSD. There's just some things that if you didn't have the VA, there would be no way of getting enough information together to really deal with the complex problems of veterans. So that's, I just wondered if that was correct.
I'm Jeff Egan. There's some of us here today from NTEU, National Treasury Employees Union.
Right.
We represent hundreds of thousands of federal employees. We do not have a significant presence in the VA system. But there's a reason why we're here. And we've learned a lot. It's a tremendous panel. I've learned so much about healthcare. But we're here today because of the war on feds.
Yes.
And let's be clear, the Koch brothers think they can win this. They've got the president of the Concerned Veterans of America on Fox TV 10 hours a week now. And they were promoting him to become, the administrator of the VA. The other side is organized. We've got to get organized. I'll be honest, I feel like this panel, as wonderful as it is and all this great work, this is like sitting down on a panel in 1936 about the Spanish Civil War. We all know what came after that, right, folks?
Yes.
You know what I mean. I see the same thing going on. I really would encourage more alliances, more coalitions, broader. I think Chicago may be a wonderful example. I give you guys all the props in the world, but you need a lot of Chicagos. And I think we need to appeal to feds, who may not have a direct stake in the VA system, because what happens to you today is going to happen to us tomorrow. And I am sick and tired of opening up my newspaper and looking at what they're doing to you, because I know we're going to be fighting that war next. That's what's coming. So I really am excited about this workshop. I'm glad that the 3 unions helped to pull it together, but I'm asking you for more. I'm asking you to reach out to other unions. I'm speaking as a trade unionist today. And the work is extraordinarily important, but so is the work that all the other federal employees do, right? Whether we're feeding people or regulating people, protecting people, all the work we do is important. But the fact is, the war on feds is not stopping, it's picking up speed. And so I just would really encourage those unions to reach out to others. Thank you.
Thank you. And we're reaching out to all the unions in this room, so thank you, NTEU.
I'm James Jones. I'm from Asheville, North Carolina. I'm a union president for NAGE Local R475. I'm a veteran of the Gulf War. I'm also a WAB, as you can tell. Started a chapter in Asheville, so I'm very involved with a lot of the labor movement and veterans issues. I represent employees on the Blue Ridge Parkway. It's a National Park Service unit, Department of Interior, and we have our sister and brothers over at AFGE Local 446 at the Asheville VA. They represent I represent the maintenance employees. They represent the rangers and the admin people in the park. But I also do a lot of work with Christine Surrett. Some of you might know her. She's the president there. And I'm trying to get my members involved with the VA, especially the veterans in my park. And we had a rally back in October of last year over the same issue. And it was really hard to get even the veterans in the park to go over there. I don't really think they understand the dynamics of this situation and how important it is. And like my brother said here, we need to form coalitions, and I feel like NAGE and AFGE Local 446, we're trying to do that with just the two unions. And I'm trying to get the WABs involved in Asheville too. I mean, amongst many other things that they're involved with down there as well. So my hat's off. I love the VA. I go to the Asheville VA. I'm disabled, 60%. I always go to the VA. They tried to send me out to the choice program one time because the wait was like 3 months at Asheville for a good reason. The care was terrible. You know, I'm willing to get on TV and tell them the choice program.
Yeah, that's awesome. We're going to follow up with you about that, because when you hear the testimony about the VA, it's incredible. Over here, yes. A couple more questions.
Can we just do somebody that's not a white dude first? Thank you. And then we'll go to you.
So my name is Jerry, and I'm a member of NEFI, another federal union. And I came to this, it's my first time at Labor Notes. My sister's AFT, she got me here. But I want to echo getting unions together, what this gentleman just said, that I was really, we have NEFI members in the VA. I know very little about it because I'm in a local that's passports. We do passports. We protect the American public, even though I feel like I'm on a factory line sometimes, pumping out so many applications per hour with like 0 errors. But you really want to echo the solidarity, and got some email addresses with some AFG folks, so I can reach out and get our NEFI, big NEFI, involved in this issue. And I know we have NEFI employees in VA places all around the country.
Primarily healthcare, yeah.
Yes. Okay.
Yes.
So, with a solidarity.
Really quick, my name is Jim Redden. I'm a member of AFSCME Local 2808. So I'm a state employee. I work for Department of Human Services.
Veteran.
And also a veteran.
Also IVAW.
IVAW, I was going to say that. But yeah, we're talking about alliances. We're, as a state employee and as a veteran, I'm facing the same enemy, which is privatization. So I would like to talk to some of the brothers I know here about how we can get together and fight that war. So that's all I wanted to say.
Thank you, brother.
Get the choice card right there.
Yeah, well, I just wanted to read something off it because I really wasn't familiar. I got it in the mail a couple years ago, and I didn't even know if it was real. And so I said, let me see if that's what I got. And on here it says, this card does not provide pre-approval. Veterans may be liable for cost of care. That is not pre-approval.
That's right.
So
you get bills in the
And
mail.
I just say, real quick, we have veterans using choice who now have bill collectors going after them because
the program is not paying the doctors, and so we have veterans' credit getting ruined through the choice program.
Well, that's happening with my mom with the bills, and they send her to choice through the choice system, and they don't know the private clinics that are in the area don't know whether to serve her or not. So then she just goes back to the VA and starts shouting, "I need to be." She's a New Yorker, Puerto Rican, so she's usually going off.
So we have a little bit more time. I was going to do a quick throw it to the panel really briefly, and then we're going to come around for a second group of questions. But we had a question about Agent Orange, coalition building, rallies.
Yeah. I wanted to address the question about, is it true about all the things that the VA does and has done? This book addresses a lot of them as far as what the VA has done It starts at section 3. It's called The Unknown Story, and it's on page 71. So be sure you grab the book prior to leaving, because it will really open your eyes to how much the VA has contributed to our healthcare in this country. Does anybody else want to answer?
PTSD was a combination of activists like only Vietnam vets against the war. None of the traditional groups participated in either lobbying or going for it. And in fact, when we first brought it up, the traditional vets groups said we were crybabies, and our war wasn't as hard as their war, talking about World War II, and why couldn't we win it on top of that? And so that question of legislation standing on its own, demonstrations in the street, and organizing is what brings about, at least with us, real change.
I want to comment on I'm the organizer here, and I want to, there are other ones, but that's just my role. I want to comment on some of the organizing comments. And I mean, really, what we have going on here is just, it's an issue of capacity, whether it can get bigger or not. I mean, how many people have done news shop organizing through their unions? A couple. So yeah, I mean, so it's a pretty intensive process to organize a new place. I mean, we went out to the VA a couple times, and we got over 100 contact of veterans. We haven't necessarily followed up with them. We haven't done our one-on-ones. We haven't agitated them. We haven't appealed to their self-interest and really try to move them and task them up and things that a union or organizer does. Yet we had this tremendous turnout. So I think, and this is, I'm doing this project as my moonlight project. This is not my job. I organize low-wage workers for a living with warehouse workers for justice. But if we had some, as Ann said, some organizers to do this work, the impetus and the excitement, both from, the veterans, it sounds like maybe we got to do some work with our union brothers and sisters, is there. So we can turn this into a big, big thing. And let's have this be the start of a conversation of forming a national coalition of federal government employees that are going to fight back against it. Because Spanish Civil Wars, I mean, I felt like this was Wisconsin 2011. This is the moment we're in. And I think we do have to recognize this. So let's have this be a beginning of forming a broad coalition that really fights back and also, puts in the government is a good thing and it is a path to single payer, because I think that needs to be a vital part of what we do as this. It sounds like, it's not just going to be a Chicago coalition. We're going to have a national coalition after this, and that is a great beginning.
One thing at our site at Jesse Brown VA that the union's looking at very closely is the hiring practices there. And when they're allowed to hire their friends and family, that's in a way trying to diminish the union. Also, we encourage them to hire our vets, and they tend to not want to hire the vets because they call them troublemakers. Because the veterans come in and they instantly will see a problem and want it addressed. So they are holding management accountable, and so they tend to fight against hiring them, and we push to hire our vets. We ask questions, we're challenging the hiring process, and that's one way of them trying to really diminish the unions is through their hiring process.
Very quickly, some of these bills are direct union busting bills. The gentleman from NTIU, as federal employees, as somebody said, we're open shop, so we have to have government paid official time. So not only are they using that to say no one who should be taking care of a patient should ever have time to do representation in the union, but they snuck in there a provision to let people drop their union dues at any time. So this is union busting, plain and simple, under the guise of taking care of veterans.
Anybody else? All right, so we're going to do one more round. I know we've seen a few hands, so Jason's going to get those. I'm going to be writing these down too, because we're going to do these in a group again.
Okay, I'm not a federal employee. I actually president of ATU in Milwaukee, and I understand about the fight in Wisconsin because I was there all night, all day, all morning. And I'm one of the rare veterans that can't qualify 2 months for the VA because I was in Beirut, Grenada, so they consider a police action, and I make too much money. But I do support the VA because I am a veteran, and I actually, marched with the VA in Milwaukee, and I'm gonna keep doing it.
Thank you, brother. Thank you. All right, we've got a question over here.
Yeah, I just wanted to respond to, there was a couple comments about a need for organizers, and as an organizer, I appreciate that. But I think the need, I was also in Wisconsin, showed up July 6th after it went into effect on July 1, was there for 14 months. And what we needed wasn't more organizers, what we needed was more members taking ownership of their union. And I would say what we need across the country is ownership, and what on the organizers, that's training members, but that's not doing it for members. Members have to do it for themselves. It's their union at the end of the day. And I would just be cautious of this sort of service. We need more organizers to do this. We need more organizers to do that. We don't have enough organizers. That's an easy answer, but that doesn't change things. And that doesn't fix things.
So panelists, keep taking notes. I'm doing it too, but we're going to go back over to the other side. We're going to get all these questions in, and we're going to get them all answered. We're going to try.
A little point here. I think there's an elephant in the room. I want to know what people think about their unions. I think the union leadership in this country is one of the major impediments to what we're talking about. I just went to AFL-CIO Midwestern strategy session, and it was fat cats laying around saying 40-year-old speeches. And I tried to go when Trump was getting inaugurated. I went to my headquarters for Chicago Federation of Labor, and I couldn't get in because it's in the Prudential Bank, and the non-union security guards wouldn't let me go near my own headquarters. And I don't know what they pay for a lease because they won't answer their own their web page lets you answer questions. And I said, "How much is your lease?" And they won't answer me. And I can't get a call back from the president of Illinois AFL-CIO who met in person, or Trumka's secretary, Trumka gave a speech that just made no sense about tariffs, which was some kind of play, I guess, to some of the unions there and sort of echoing Trump. And this guy sat on a board with Trump a year ago before they all resigned. What are our union leadership doing? Well, you can tell with the teachers right now, or the people who are out in front right now in the whole world, you can say that they're completely the enemies of the teachers. And they're doing everything they can to stop them and get in the way and demoralize them and try to get them back in the door to shut up. So what are our leadership doing?
All right, we're going to come back over here.
Hey, Peter Shapiro. I'm a retired letter carrier, and I've been working on single payer in one venue or another for about 10 years. I have a question, actually. This has to do with the VA's underfunding. My sense is that it really started to get out of control during the Iraq War, which was supposed to be over in about a week, and which actually produced, just horrendous medical consequences that the VA was not prepared to deal with. Is this something that I think that we could work with in terms of explaining to people what's going on and why?
Thank you. VA funding.
Oh, me? Hi. Judy Lucas. I'm a registered nurse with the NNU. I'm not a veteran, but thank you for everyone in this room that has served. I'm home health for 8 years, so I don't work in the VA system, but I have taken care of a lot of veterans who have gone, 911, we had a heart attack or something. And they come back and they resoundingly want to go back to the VA system because it is so good. They, are sent home with 30-day prescriptions till they can get an appointment. They go to the pharmacy and their jaws drop at how much their medication is going to cost them compared to what it costs in the VA. And so they're grateful, 911, we're taking you to the closest hospital, but they want those VA benefits. And they worked for it. They were promised that. And I think you know, if we, like you had said, mentioned the good things, because there are so many people that, my highest compliance, I haven't done an official study, but I would say my observation of what I've seen in the home, people who have gotten their medications through the VA, they have all their meds. And other people, not necessarily. It may be, they may decide which ones they can afford.
That's right.
Thank you so much.
Hi, my name is Sarah, and I'm here in my capacity as a staff member of In These Times. And I'm really sorry I got here late, so apologies if you've already talked about this, but I know that many of the veterans organizations that are involved in this campaign emerged in opposition to U.S. wars, and I was wondering how you see this work relating to that anti-war work and whether you see it as an anti-war project.
Thank you. I think we're going to do 2 more questions. We're going to run over here really briefly, and then Aaron, and then we're going to turn it over to our panel for our last 10 minutes.
No.
My name is Adam Felche. I am a former Marine, currently work for Social Security and setting people up with Medicare and retirement benefits. And my question is, what will happen to the VA when we finally get single payer? Do we still have a 2-tier system for veterans and everyone else? Or does the VA kind of become a branch under the national system? I'm just, if there's been any thought on that.
Thank you. Expand the VA.
Exactly.
All families.
Thank you.
That's right. Do you want to introduce yourself and your organization?
Oh.
Yeah.
It answers a couple of questions, I think.
Hey, I'm Aaron Hughes. I'm with the Right to Heal campaign. I'm with Iraq Veterans Against the War, About Face Veterans Against the War. I helped start the coalition with Roberto and Ann and Adelina and Abbas and our friends at SEIU. And I'm just really humbled that we're bringing this group together. And I'm really excited that there's interest in taking it to a national level and getting national unions involved. One thing that's just crucial to me in this process is that we are building a culture of organizing within the veteran community and within the local unions. And that we're not trying to jumpstart to that national level. We need that help. We need that counter bill. We need to go on the offensive. We need NNU national. We need SEIU national. We need AFG national to put a bill out there that's progressive, because until they do that, the Democrats are just going to fall into these conservative reactionary bills because they don't have another choice. We need to put an alternative choice out there. But on a local level, our job is to organize the vets, organize the workers, and that's really where we're focused. And it's so easy to slip out of that and to focus on talking and doing media spots and not building those core relationships that we have to build. Because you know what, the Koch brothers, they got a 20-year plan to dismantle the VA. They say 2035, whole thing privatized. That's their plan. What's our 20-year plan? And for me, that starts out building a local coalition here in Chicago that can fight, that can show up for progressive causes in the next 20 years and fight. But we don't have that yet. And so I feel like that's what this is about building those relationships, those deep relationships, so we can be there for the long haul, so we can build leadership for the long haul, because that's what we need. We don't need just phone calls, we need leadership for the long haul. So that's what we're doing, and I'm just humbled to be here with all these unions.
Thank you so much, bro. So we had a lot of questions. I'm going to turn it over to the panel. A few of the questions, well, first of all, thank you all for the support. We heard ATU, NTEU, other unions here pledging support, active support in this campaign, but we had questions about union leadership, involvement, funding of the VA, a few others. So I'm going to turn it over to our expert panel here and let you carry us to noon.
I just want to, quick mobilizing thing following up on yours. The way we have gotten Republicans and Democrats interested in not privatizing is saying, do you want the VA in your patient care or whatever? So it's very local, and the more they hear directly, I think that's where the action is.
I learned that when I was a kid, 2 + 5 is 7, 3 + 4 is 7, 1 + 6, 1.5 and 5.5. We are all different in here, and we all have our own individual needs. We have to take care of our kids. We have to pay the rent. We have to work our job. I remember when I first started at the VA, I was on probation. I had the meanest supervisor on the planet. This woman literally just said anything, let anything come out of her mouth, totally unprofessional. If I was a union steward back then, I would have sued her about 7 times, all the things that she did wrong. And she's still working there, by the way. But yeah, we just really have to just understand that there's a bigger fight. We have to get over this fear. I just learned over this 50th anniversary of Martin Luther King that his mom got murdered. I didn't know that. All this Eyes on the Prize and all these things that I've read and studied, I did not know that Martin Luther King's mom got murdered. She's sitting in a church singing good church songs. And they did this to inspire fear, to not get involved. We have to get involved. There's veterans sitting on the sideline. I'm going to weather the storm. I'm going to let Jesus take care of it. There's some savior that's going to come out of nowhere and make this right again. And we have to overcome this fear. I've had VSOs that I've given them my power of attorney, and they've taken over my case, and I'm like, yeah, I joined the SEIU. Oh, those guys, they don't do anything. And I'm like, well, if it wasn't for those guys, I'd have been fired. They're the ones that went to bat for me when my supervisor was oppressing me. I'm working with contractors, and these contractors are trying to get on as a regular GS, and they're just trying to eliminate competition, lying on me and doing all kinds of stuff to get me fired. And the union protected my job. They were fighting against these contracts. Just to wrap that up, we just have a need to get over these fears and fight and unify.
I'd like to respond to 4 of the questions or comments that were made. First, to the comment about organizers not being the only solution in fixing things. Again, I've been doing union work for only 6 years. Everything I've learned pretty much the hard way, and through relationships and going to some trainings. And my background is I'm a licensed clinical professional counselor. So I understand human beings and the human psyche very well. And I agree, organizers are not the only answer. One of my greatest frustrations starting a brand new local is trying to get, and we at AFGE Local 789, I only represent professionals. And professionals are, they're known to be very difficult to organize. For a lot of different reasons. And I can't, I'm constantly reminding folks, your dues are not for a service. I am not the union. We are the union, and I'm constantly, reiterating that mantra over and over again. But on the other hand, when I have members that I haven't even met in the last 6 years because I do not have the time to go out and have a conversation with them because I am so busy doing the work day in and day out. So I don't think organizers are the only solution, but I think they are a large part of the solution for my local. Regarding the ballooning costs of the VA since the Iraq War, absolutely there is data that does support that. I was trying to find it as I was listening to the other questions. And I want to say from like 2012 to 2016, our patient loads increased by over, I think, 60%. Just marinate in that for a minute. That's huge. And the types of injuries that we're dealing with are obviously very different than past wars as well. So we had this huge increase in patients seeking care. And do you think our budget increased by that much? Do you think our staffing increased by that much? I believe Adelina said it very well when she was talking about many people are leaving because of the stress of giving that kind of care. I was hired in 2010 at the VA as an addiction therapist. I worked in the methadone clinic. I worked in the psychiatric assessment clinic. The stories that I had to listen to in part of giving care were very, very awful things to hear. And I understand that that is my job, but I also need to take care of myself. Nursing's no different. The work that we do in the VA, particularly here in Chicago, the acuity level of our patients is very, very high, and the work is very demanding. And when you're already taking care of that kind of patient load, and then in addition to carrying twice the load, it's very, very difficult to convince people to stay. Single payer, as far as what will happen to the VA, that was a really interesting question. My initial thought on that is I would love to see single payer, absolutely, but I also believe the VA still has a footprint in that dynamic because the care that we provide is specialized to veterans. Veterans have very specialized healthcare needs. So I would love to see single payer, but I'd also love to still see the VA as it exists today. Union leadership, the question of union leadership. Again, I can only speak from, I haven't had a lot of time to get out to a lot of these meetings with union leadership and have discussions with them about stuff, because in addition to doing all the work that I do have a private life, and I also have a private practice, and a lot of these things take place during hours I'm unable to go to. But I can speak to that from the perspective as a new local president. As I mentioned earlier, everything I learned the hard way. And what I've seen in my short amount of time in the labor movement is we are at a stage where the old guard is leaving, retiring, and with that, a lot of good knowledge and experience is leaving with folks. And why the national unions have not, the national union leadership has not created a mentorship program is extremely frustrating to me. You know, I'm a pretty quick learner, I'm a hard worker, but I've seen a lot of people who were interested in getting involved in this kind of work shy away from it because they don't have mentorship available to them. So that's all I had.
I'll just comment actually, because Ann answered a lot of the things. As far as the anti-war thing though, because I work very closely with IVAW and VVAW, although I'm not a veteran. But I, like me personally, I didn't perceive this as, anti-militarist per se, because there is a necessity to have a coalition with veterans who probably are kind of pro-war. And the Coalition of Veterans, which is one of our partners in this campaign, probably has, some people who feel more positive towards the military. But one thing that I kind of, I work very closely with the UE, who puts out anti-war statements, basically is always left on these things. And, a lot of their rank and file members aren't necessarily, of that politics. But when you kind of bring out the class contradictions and how war and militarism hurts the working class, you're able to kind of build those politics in your organizing. And I think that, the attack on veterans' health care and union members who are veterans brings out some of those same kind of class antagonisms where you could kind of lead and maybe have some useful discussions about militarism and U.S. foreign policy as part of this organizing. So I do see some potential there, but, we don't want to necessarily, in my opinion, lay that down as the foundation because you may alienate some people that we actually need to work with right now.
No, Bush did not take into account any expansion of the VA. In fact, 10 years ago, the Bush administration closed 10 VA hospitals, starting in Boston, coming to Chicago. The Rust Belt Democratic voters, in the middle of two wars that were not prepared for, knowing people are going to have to receive medical care, and he closed them. He almost closed Jesse Brown here, and it was through Congressman Danny Davis and a lot of African American churches. They saved it, but they still closed the VA down and in the Golden Mile. There used to be a lakefront VA that people besides this, right, And so, no, they didn't do it. So now we're in the time of never-ending war. It's almost sci-fi. Is there a place left where we don't have soldiers or Marines being injured and injuring other people and suffering the moral damage that's connected to that? We have to expand the system. We have to include children and families. And if you're really going to think of that, then what you got to do is, at a minimum, contact your congressman, contact your senator, do something more, and get your friends to do it as well.
Yeah, I know we're out of time, but I just had something quickly I had to say. When I was active duty, I worked over at the Naval Hospital in Great Lakes. They shut that down. That hospital just happened to be right over to Lake Michigan. It had a magnificent view. Every veteran that stayed in there bragged about staying up in there because they had an ocean view. It was beautiful. They shut down that hospital. In fact, they knocked the whole building down. They even knocked down Corps School where I got trained. And they moved everything over to the VA over at James Lavelle, the VA over there across the street. And it's a joint venture with the active duty and the veteran GS workers. And I think it was a 5-year study, something like that. But after the 5 years, they found out that it was not cost efficient as far as merging the active duty with the VA. And what that property's just sitting there right now. And, you know, from my intuition, you know, I'm just speculating that maybe some of these private sector people are trying to grab that government property so they can set up some condos and some beach stuff over there by that lake. It's a really nice lake. And don't forget about Fort Sheridan.
Yeah. So we've gone a little bit over. I really want to thank all of you. The reason we're here is because as you all know, that's why we're here. There's no better place to build a coalition than Labor Notes. The two things you got, I mean, it's really the truth if you think about it. Every time I come to these conferences, I'm amazed by the energy and to see what's going on around the country and around the planet. Usually during these, we ask everyone to take out their phone and make a call. We've gone a little bit over, but I'm going to ask everyone to please take this form with you. Please make these calls to your members of Congress about these two bills that Marilyn and others spoke about earlier. And there is no way for us to help bring you into this campaign and join you in your efforts if you don't fill out this other form. So please either bring it up or leave it on your seat. We'd love to continue this conversation and build this campaign out from here in Chicago. But please give it up for yourselves, for this amazing panel, for all the work you do. And then come get your book, too.
That was a good question.